Consultant psychiatrist practicing in Panvel, Mumbai. So today we are going to talk about anxiety disorders. As you know, anxiety is a very common phenomenon, and it is experienced by almost everyone in the population, like older population to the young children going to school. So usually in anxiety we have lot of palpitations, tremulousness, restlessness, becheni, and to the severe extent amounting to impending doom or having an heart attack. Huh? Or the patient sometimes experience such a severe anxiety, they land up into the hospitals to the physician in ICUs also. So this anxiety is almost 4 to 5% of the patients are experiencing anxiety in general population. And if the parents or if there is a genetic predisposition, then the rate of the anxiety also increases. For example, if one of the parent is having anxiety, then the children or offspring will have more chances of having panic attacks or generalized anxiety disorders. The rates increase up to 10 to 15% also. If two parents are having anxiety, then the rate may increase to up to 40% also. So, what are the causes of anxiety disorders? So, exact causes, the researchers has been doing a lot of extensive research throughout the world, but they have not found any exact cause, but there are multiple factors which may be aggravating to such anxiety or panic attack. So they can be genetic causes, as I told. Second thing, environmental factors are there. If any person is subjected to chronic stress for a long time, so he may have an anxiety disorder, or there is an acute stress for short period of time. For example, death of a loved one, or a natural calamity like earthquakes or floods. So that can also cause anxiety in a certain individuals, or for that matter, for appearing an exam, or going for interview for a job. So there can also the person can experience severe anxiety. Also, substance dependence, if there is a comorbid alcohol or tobacco smoking or any other psychoactive substance, then the person can have anxiety attacks. So, what are the signs and symptoms of anxiety? First of all, we need to see that there are different types of anxiety disorder. It can be a plain anxiety, it can be generalized anxiety disorder where the subject experiences anxiety in many situations. Then there can be a specific anxiety. For example, the person is afraid of heights or water or closed places, we call as claustrophobia, or the person might be anxious of going out in open in a crowded places, or a specific anxiety, for example going for an interview or job. There can be panic attacks also. In panic attacks, we have a lot of palpitations, tremulousness, coldness of feet, sweating, nauseating, butterflies in stomach. The patient may have giddiness or darkness in front of eyes, or if there is a severe anxiety, he may go to washroom also frequently, frequent urination, or going for stools also, or the patient may feel having impending doom, the heart is like racing, or he may have an heart attack. So many of such patients goes to physician or cardiologist also, and they do their investigations, but still there nothing is found. So then the patient may be referred back to psychiatrist. So so these are the little bit of signs symptoms of anxiety disorders. Now, how we are going to treat those anxiety disorders? So treatment is pharmacology and counseling. So pharmacology, nowadays we have very good anti-anxiolytic medications like SNRIs, SSRIs, and these molecules, when given in a proper dosage and supervised form for a particular period of time, so the patients benefits a lot. We are seeing a lot of anxiety disorders nowadays. Before COVID also and after COVID, the rates have increased like anything. So with proper medication and proper follow-up with psychiatry can also counseling, specific counseling, cognitive behavior therapies or individual therapy or group counseling, the patient are treated very well, and the psychosocial rehabilitation is also done very well. So what I appeal to everyone is to if you have any anxiety or panic attacks or anxiety problems, please go and consult your psychiatrist and do the proper treatment. Thank you.